Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, August 12th, giving you the update from Albany Med. All right, Fred, we have a lot to cover here. Pretty heavy on COVID. Let's start with the first graph here. Here's New York State, people currently in the hospital with COVID across the state. That number is 1,367. Let's pop open the next graph here. Here's Capital Region. The most current numbers, Fred, are 72. A week ago, that number was 56, so that gives you some perspective where that's going. We'll talk about our phone call here in a second. Next graph here is admissions and discharges, specifically to the medical center. Visually, you can see now we're somewhere between 3, 5, or 6 admissions per day. You'll also see that yesterday is the first time in a while where we've had somebody in the hospital with COVID who died. So that's something that occurred yesterday. Last graph here for a while. Let's look at the morning census here at the medical center. Currently 27 people. Let's break down those numbers a couple different ways, Fred. First of all, 19 on the floor, 8 in the ICU, none currently on ventilators.
None on a ventilator.
Fred, you've made this point many times. The admissions will go up, and then other numbers will shift after that.
That's
so do you want to make a prediction what we're going to see there maybe in the next couple weeks?
Well, Dennis, I think, we're probably going to get up into the 40s in terms of total numbers.
But as far as the ratio of floor and ICU?
Right, and then we'll see a shift from floor to ICU, from ICU to ICU and ventilated, and then the deaths will follow after that.
That's been the pattern.
That is the pattern. Now, I will say that with vaccinations, maybe that'll change, and we'll talk about that.
We absolutely will. Let's break that 27 down a couple more ways. 24 adults, 3 children. Those children are age 12, 12, and 19. In the last 7 days, Fred, this is really what you were talking about with the vaccine.
Yeah.
In the last 7 days, we've had 26 come in the hospital, and we've had 14 go out. So that's the net 12 that have come in the last week. Of the 26, 6 of them are fully vaccinated. So let's just put that right out there. And let me ask you the question. When you hear that number, Fred, what does it say to you? What does it not say to you that we've had 6 of the 26 who've been fully vaccinated?
So Dennis, I think we've expected that we were going to see some vaccinated people become hospitalized. You've got to put that in the context of what's happening in the community. Yeah. So 6 out of 26 is about a quarter.
Right.
If you think about it, the vaccinated population in Capital Region is more like 70%.
Right.
So that means that 25% came from 3 times as many people as the unvaccinated people in the hospital today. So said another way, it's still very, very important to be vaccinated. Vaccinations are making a difference because the hospitalization rate is lower.
Absolutely. You've talked about this in the past. There are studies that show this as well. First of all, we think that what's probably driving these breakthrough cases, as they're called, is probably in many cases the Delta variant.
Yes.
More contagious, more infectious. However, we do know that if you are vaccinated and if you do land in the hospital, generally speaking, you tend to come from that same group of patients who landed in the hospital in the first place, older, and the comorbidities of weight or diabetes or hypertension. So those are still risk factors even in the vaccinated. But if you land in the hospital and you are vaccinated, in the past at least you are less likely to need ICU care, less likely to need a ventilator. Is that still your thoughts?
That is still, I think, the case, Dennis, absolutely. And there's one other variable in terms of the vaccinated hospitalized patients. They're older.
Right.
So at least 2 of those patients are in their 80s.
So explain that to someone who may not understand. So if I get vaccinated, I am going to build up antibodies as a result of that. So even if I were to get COVID, I already have more antibodies against it than I would if I had not been vaccinated,
Absolutely, correct.
Which is why maybe the duration of the illness or the severity of it may be slightly less.
That's right.
So again, the take-home point is Dr. Venditti and I want to be sure we share with you honest, factual information. 26 in the hospital, 6 of them are vaccinated. But again, Fred, does that mean that people should avoid the vaccine, or do we still firmly believe they should get it?
Absolutely not. They should absolutely still get vaccinated. It's in your best interest, your health's best interest. It's in your family's best interest. It's in your friends' best interest. It's in your community's best interest.
I agree. just to give you another window into what's happening here in the medical center, COVID is not the only virus or the only pathogen that is bringing people into the hospital. There's another virus called RSV, respiratory syncytial virus. This is a virus that many in the healthcare deal with normally in the winter months.
That's right.
And right now we have 7 people in the hospital with that. The breakdown is 1 adult, 3 pediatric, and then 3 also in the NICU. So that's where the 7 comes from. In the last 7 days, we've had 11 come in with that and 6 leave. So Fred, why do I mention that? Is that meant to cause any concern or alarm? No. RSV is something we deal with all the time, every year. It's seasonal. The treatment is often supportive care. It's sometimes supplemental oxygen or fluids. I mention it to say there are other things that we deal with other than COVID, and we're seeing that as well.
Absolutely, absolutely true, Dennis.
Okay. Fred, 3 words that I'm going to give you, and I think it would be awesome if you could give me some scenarios, because they're often used and perhaps used interchangeably, but they shouldn't be, because they mean different things.
They do.
So that's endemic, epidemic, and pandemic. So we'll start with the first one, Fred. What's an endemic mean?
So Dennis, let me explain this by using an example.
Okay.
So I'm going to talk about malaria.
Okay.
Okay. We don't see much malaria here, but malaria is still in the world. It is said to be endemic in Africa. So what does that mean? That means in Africa, people get malaria.
Yes.
It's not rising in incidence. It's not shrinking in incidence. It's present. And frankly, if you go there, there's a chance you could catch malaria, but it's kind of in a steady state frequency within Africa.
Okay. Epidemic.
So same example. So if for some reason malaria's incidence started to spike in Africa, at some point we would call that an epidemic. So let's say that the mosquito or the plasma, the mosquito changed, and so it became more prevalent.
Yeah.
Something drove that. It could cause an epidemic, which is a rising incidence of an infection, or it could be a rising incidence of some other health concern like smoking or obesity.
Okay, excellent. Or gun violence.
Or gun violence, absolutely.
Okay, so now we're up to pandemic.
So same example, a pandemic would occur if not only was there a spike in the incidence of malaria in Africa, but also throughout the world.
Okay.
And so for whatever reason, malaria increased in frequency everywhere around the world.
So let's take COVID. COVID started somewhere, started in Wuhan, China, we believe. It started as an endemic there.
That's right.
It became an epidemic. It became a pandemic.
As it spread around the country and around the world.
Will it be a pandemic forever, or can it go back in the opposite direction?
So it can absolutely go back in the opposite direction, Dennis. So when people have enough natural immunity from infections and immunity from vaccinations, it will probably never go away.
Right.
There'll always be a low level of it in the community, and that's when it'll be endemic.
Okay, very helpful. Thank you for explaining that. That was great. All right, let's shift gears for a second. Let's talk about some other issues out there. Fred, we have some new physicians, otolaryngology, ear, nose, and throat, that are opening up a practice starting next Monday in Niskayuna.
That's right. So this was a group of 3 physicians who had been in practice in Schenectady and decided to join us. So they will be seeing patients in our Niskayuna facility on Upper Union Street. They have a very nice office on the 1st floor, and they'll be doing their procedures in the ambulatory surgery suite on the 3rd floor. Fantastic.
We welcome them to the OpniMed team, and congratulations to the faculty practice and others who are bringing them on board.
Tremendous.
Fred, we did a video earlier this week on the blood drive. That was lots of fun. We had some positive feedback on that. What were the results of the blood drive? Did we have a good day?
We actually did, Dennis. I think we had 18 more units of blood than normal that were collected that day, so that's fantastic.
That is fantastic.
So the next blood drive, I think, is September 21st. It's September 21st here at the Medical Center. So we won't film again.
No.
But everybody should think about giving blood.
Yeah, maybe we'll use the same video, though.
We will. You'll see it. You'll see it again. We're getting royalties, right?
I think so. We'll see. CDPHP Workforce Challenge is, I believe, a 5K. That's a 3.1 mile run. And the date by which to sign up was supposed to end last Friday, but it was extended to tomorrow. So there's still time. So
there's still time.
I've
so
signed
sign up.
Lastly, well, let's pop up a picture here. So we have a member of our workforce that we would like to recognize who has won the Daisy Award. So that's Justine Rapplier, and she works on E6, Labor and Delivery.
Labor and Delivery.
They've been very busy lately.
They really
They've been
have.
very busy. Fred, I think you have something to read about Justine.
So this was the nomination. It was by a spouse of a patient Justine cared for. Upon a successful and very stressful procedure, Justine was right by our side the entire night, offering to heat up food during late hours of the night and even offering food from her own dinner. She took care of us through this night and got us everything we needed. She even offered to do my wife's hair.
Wow.
That small but giant gesture was huge considering all my wife had just gone through. She was an angel.
Yeah, we hear that word a lot.
We do.
Angel.
But it's true, Dennis.
It is true.
It's really true.
So we congratulate Justine.
Congratulations, Justine.
Yeah. And the entire team on E6 will get their cinnamon buns.
Yes.
Yeah. One of these days we have to go up and
Yeah, we should go and help
maybe
them. Help them with
that'll
those
be our
cinnamon
royalties.
buns.
Yeah. All right. So congratulations to Justine and all the Daisy Award winners in the past. Okay, I think that'll do it, Fred. Anything else?
No, I think that covers it, Den.
All right. It's going to be warm this weekend, so people need to be careful.
That's right. Drink plenty of fluids if you're outside.
We have our workforce here 24/7. They'll be here this weekend. We thank all of you. If you're interested in coming here, we have a campaign, Capitalize Your Career. We encourage you to check that out. And we always are looking for people who want to come in and be part of our great workforce here. We'll be back again here next week. We'll see you then. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.